claiming to cure back problems, but how do we know what works and what doesn't? Joining us to discuss are Professor Chris Maher from the University of Sydney and physiotherapist Ursula Dalkic. Blew it. Normally that's your job to blow the names. Chris, your team tested a number of these apps to determine if they were of any quality. What were the findings?
I guess we've found two things which are important. The first is that none of these apps have been tested to see if they're safe or they're effective. And the second thing is that generally these apps are of very low quality. So in terms of usability, the look and the feel, the functionality, the engagement, most of them are very poor quality. And there's really only about 10 that were of acceptable quality.
Really?
There was none that were of good quality, none of excellent quality. So it's a bit of a problem.
Of the 10 that were okay, would you recommend that people look at those, or that not even worth that?
No, I don't think so, because even with those, they had some myths about back pain, some really weird stuff. And of course, as I said before, none of them have been tested to know that they're safe.
Yeah.
They actually do help people with their back pain.
They could actually be counterproductive if they haven't been tested.
Exactly.
Now, Ursula, I mean, you're a physiotherapist. Yes. You know, what are the most common causes of lower back pain?
So it's one of those things that is multifactorial, and it can be influenced by our physical environment and our emotional state as well. So it's multifactorial, like I mentioned. So coming in and looking in the clinical setting, it can be a result of trauma, a biomechanical muscle loading issue, or some referral pain as well from elsewhere. So we really want to try and diagnose it appropriately, and that's the best way that we can diagnose it through the allied health professions as well.
Yeah, right, so it really requires somebody, a health professional, to actually be looking at you specifically and come up with a program.
Yes.
If you want to be avoiding lower back pain in the first place, are there certain do's and don'ts that you should always keep in mind?
With the actual apps, do you mean?
No, just in our everyday behaviour. I mean, does it help if we're, for example, drinking a lot of water? Does it help if we're doing our hip flexor rotations in the morning, all that sort of thing?
Yeah, hydration is always good for our own health, but when it comes to what we try and promote, which is evidence-based practice, that's the movement, that's the minimising the aggravating behaviours, that's also identifying risks that we may have at home or at work, looking at the ergonomics, all those widespread things that may influence our back.
So it's really personalised.
Exactly, and we want to try and create that individualised care.
Chris, when we're talking about some of these apps could actually cause more harm than good, part of that is that people that suffer from back pain generally do a huge range of things, and sometimes that's exhausting in itself. So actually wanting to follow a program, is that what got you interested in this in the first place?
Well, our team was interested because it's exploding. There's lots of these things out there. If you look at the web, there's lots of misinformation about back pain. And I guess we're worried about people doing the wrong thing. If you're thinking about what you can do, we now have a very good understanding of what works for back pain, but unfortunately people aren't getting that care. So we want to make sure that there's good information out there so that people can choose the right things to do and seek care from appropriate clinicians when necessary.
Well, as Ursula says, so many different causes. You really want to pinpoint what's causing your lower back pain and not just rely on some generalist advice. Yeah?
Makes sense. Chris, Ursula, lovely to see you. Thank you so much.
Thank you very much.